You changed your diet, you lost the weight, you started working out, and somehow your cholesterol got worse. If that's happened to you, I need you to hear this, because this is one of those most frustrating moments in medicine. Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Let me tell you about the patient of mine. Let's call him David. David comes in for his follow-up. 6 months earlier, his LDL, that is the bad cholesterol, was around 156. We had the conversation you would expect. David, clean up your diet, move more, take it seriously. And he did. He lost about 30 pounds. He was in the gym 4 days a week, eating better than he had in years. He walks back into my office, sits down, and you can tell he's expecting a win. We did his blood draws the week prior to his visit. Now we check his labs. His LDL is now 195, up from 156 6 months earlier. And the look on his face, I see it all the time. Confusion, frustration, almost betrayal. He looks at me and says, "Doc, how is that even possible? I did everything right. I did exactly as you told me to do." And this is where we need to get into the science of cholesterol and how your body makes it and handles it. Because that question, that exact moment, that's when most people get misled and give up on good, healthy habits. Because when we've been taught to think of cholesterol as something you eat your way into, that's how you get misled. Because that's not actually how your body works. Your body, specifically your liver, makes the majority of your cholesterol, around 70 to 80% of it. Not because something is wrong, but because your body actually needs it. Cholesterol is used to build hormones, cell membranes, vitamin D. So your cholesterol level is not just about what you eat, it's about how your body is programmed to produce, process, and clear it. And that's where genetics comes in. Some people are born with systems that clear LDL efficiently. Others are born with systems that don't. Sometimes it's one gene. Sometimes it's dozens of small ones adding up. And what that means is this: you can do everything right, and your cholesterol can still be high. There are even situations, especially with rapid weight loss or sudden diet patterns, where LDL can temporarily go up as your body mobilizes fat stores. So what happened to David? David didn't fail. His biology just showed up. This is the part that you have to work with your doctor for mutual understanding of how cholesterol works and so that you can get appropriate care. Because this is a part that's hard to accept, but incredibly important. Your effort still matters. What you did, losing weight, exercise, changing how you eat, that lowered your overall risk in ways that go far beyond cholesterol. Your blood pressure got better, insulin sensitivity improved, inflammation reduced. Those things are beneficial. But cholesterol, especially the LDL, is a little different. It's one of the most genetically driven risk factors we have. So sometimes lifestyle gets you part of the way, and sometimes it doesn't get you all the way there. If you're in that situation and you've done the work and the numbers still don't look how you expected, here is what I want you to think about. Okay, first, don't take this as failure. Your habits are working, even if this one number didn't respond the way you hoped. Second, understand what the goal actually is. It's not perfect labs. It's lowering your risk of heart attack and stroke over time. Third, be open to using the right tool for the job. For some people, that includes medication. not as a replacement for your effort, but as a complement to your effort. And fourth, zoom out. Your health is bigger than one lab value. Keep doing the things that you are doing because those keep you moving forward. You didn't do everything wrong. You just ran into biology. And once you understand that, you can actually make the right next move. This has been another episode of The Daily Brief. I'm Dr. Albert Takem. See you next episode, because the fight for your health doesn't stop here. This has been The Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.